I am Cordelia Sullivan, Supervisor of Special Education Secondary Programs, and I'll be talking about Diagnosis and Testing, Module 6. How is dyslexia diagnosed? Before referring a student for a comprehensive evaluation, a school or district will track the student's progress with a brief screening test and identify whether the student is progressing at a benchmark level that predicts success in reading. If a student is below such benchmark, school may deliver intense supplemental reading instruction before determining whether the student needs a comprehensive evaluation. That would lead to a designation of special education eligibility. Some students simply need more structure and systematic instruction to get back on track. For those students, putting the emphasis on preventive or early intervention makes sense. These practices of teaching first and then determining who needs diagnostic testing based on response to instruction are encouraged by federal policies known as Response to Intervention, or RTI. RTI is a General Education Intervention Plan program. It is composed of 3 levels of intervention, from least intrusive, Tier 3, to most explicit, Tier 1. All students have access to such program. If we exhaust those strategies and services and the student continues to struggle, then the student may need specialized education. A child study team comprehensive evaluation is recommended. An evaluation is important for 3 reasons. Reason number 1, identifies the likely source of the problem. Reason number 2, develops a focused remedial program. And lastly, documents the history of the student's learning disability. Such documentation is also important to obtain accommodations for higher education assessments, for example the SATs. A comprehensive evaluation typically includes intellectual and academic achievement testing, as well as an assessment of the critical underlying language skills that are closely linked to dyslexia. These include receptive and expressive language skills, phonological skills including phonemic awareness, the student's ability to rapidly name letters and names, and the student's ability to read lists of words in isolation as well as words in context. The testing can be conducted by trained school specialists or outside specialists. A child study team evaluation is the process of gathering information so a plan of action can be developed. First, information is gathered from parents to understand the development and from teachers to understand the educational opportunities that have been provided. Then, tests are given to identify strengths and weaknesses that lead to a diagnosis and a tentative roadmap for interventions. And finally, conclusions and recommendations are developed and reported out.